Welcome to Study Club, officially. We are talking about how to create a culture of success.
Success.
That's right. And so what I like to start with is do a little workshop, get everybody active here, is what would you define culture as? What do you define culture as? So I want to hear from all of you in the audience. Let me know, just kind of, you can chat me in the chat box or the question box. Put down what culture means to you. So let's get some ideas here. Culture. Here we go. All right. So Elizabeth is saying culture is environment, the environment of the office. Okay, that's good. What else? What else would you define culture as? Allison seconds that. Environment. We have 2 for environment. Yatin is saying attitude and mindset. Niraj, one of our all-star students, culture is the spirit of the team. It's the emotional perception of what a patient sees and feels. That's going to the patient experience, right, Larry? Jennifer, another all-star student. 1, the way you are perceived by the public. We're talking about perception. And the attitude and personality of the office. Lysandra, characteristics of an individual and how he or she is portrayed. We'll get a couple more. 2 or 3 more. We'll continue. Larry, you were saying that, and you'll be talking about that part of culture is leadership.
Yes.
Leadership, absolutely. Okay. All right. So, one of the things that I'll just interject here, and then I'm going to just let you off on the races here. If we're going to talk about leadership, I think culture begins with the vision of the dentist. And one thing that I remember that my buddy Tony Robbins talks about when it comes to leadership is standards. What's the standard of your office? And so when we think of standards, there's what you used to be able to do in an office in terms of being successful, you can't do anymore. And I talk about this in some of my webinars. But so there's this kind of matrix where you say, well, if you do a bad job at putting your standard out there, right? What type of results do you get if you do a bad job, Larry?
What kind of results do you do if you do a bad job?
Yeah.
You would get substandard results, or, it might have an effect on the way you do your scheduling or how you answer the phone.
Right.
How you communicate with your patients, how you treatment plan.
Well, the deal is that used to be the case, but now in this competitive environment, you do a bad job, you're not in business. You're out of business. Okay. And just being a dentist, you have to do a halfway decent job to stay in business. And so if we continue that concept, we say, well, what if you do a huge jump? You're actually doing a good job, good average job. What type of results are you getting, Larry?
If you're just doing an average job?
You're doing good or average job. What type of results do you get?
Tell me what you mean by results, though.
This is your standard, and the what you put in, you get a good or average. You're doing good or average standard or effort. What result will you get when you put that in, that input? What's the output?
Oh, you're just going to get an average.
Average.
Kind of result.
Well,
and probably not any better than anybody else.
You're actually going to get poor results because if everybody's doing a good job, which they have to be to succeed, you can get poor results. So the next level is you do a great job. And if you're following my logic, you do a great job, you end up getting average results. But what we're talking about here in all of our training is if you do an all-star or outstanding job, what type of results do you get?
Well, then you're going to get a phenomenal result.
Right. So, well, if you follow the logic here, you would think it would just be great job. But once you get to that standard or that culture or that leadership level that is, that top 1%, you get everything, because that's just kind of how the system is played. There's only a few great companies, right, and great dental practices that just stand out. The ones that, you work with and you help build, Larry, that are immune to a lot of the pressures out there that are being worried. And I guess what I would lead off is when you set a standard where it begins with the dentist and the leadership, that you then create this culture that helps sustain that standard and that vision.
Well, because culture is a byproduct of good leadership.
That's right. Right. And the prerequisite of good leadership is to have a commitment to a standard, and it has to be
Correct.
set. And the thing
Correct.
about culture is if you don't set a standard, okay, then this vacuum culture happens, and it becomes this chaos, right, of drama and other things that we talk about versus what you're looking to achieve. Okay, so with that, I'm going to kind of mute myself, and I'm going to turn it over to Larry. So as you listen to Larry and some of the points we kind of prepared, think about some questions you want to ask at the end so that we can address. So
Yep. Because culture is one of those very interesting things. Everybody wants it, but nobody ever seems to really know, like, how do you get it? And so I looked at everybody's definition of culture, and all of them are correct. That's all a part of culture. I think a good example that I can give everybody is we were at a neighborhood function, and all the neighbors were there, and there's little games for the kids and things like that. And we have some neighbors who are just down the street from us, and I know that they're not listening tonight, so I can say this, but on our own, when we refer to these neighbors, we call them the Bickersons. Some of you might remember that old cartoon that used to be in the Sunday papers about a couple that constantly fought and bickered back and forth with each other. And so we call them the Bickersons. And you might say, well, why do you call them that? And it's because every time they get together, I only see them in public. I don't know what they do at home, but when they're in public, they're constantly bickering at each other. They're at each other's throats all the time. And then we notice when they're playing with the kids and there's a game and maybe the kids don't do as well in the game, then they're harping on their kids and they're yelling at them, and then the kids are yelling at the parents. My point is that the reason why they developed that nickname is because of the way that they behaved. And so I'm telling you this story because I can tell in their family, in their household, the culture of that house is to just shout and yell and complain at each other and shout at the top of their lungs, because that's the culture. That's the way that they do things. We know in a dental practice, any organization, we couldn't survive if we had that kind of reputation. So I'm going to give you a definition of culture. And so the definition of culture for our conversation this evening is the beliefs, values, behavior, language, and the systems that make up your work habits. Essentially, it's what you do every day. That is your culture. And so some people have a culture based on intent. We want a culture of professionalism or teamwork, or we want a culture of high quality customer service or whatever. And so they have to sit down and think to themselves, what do I do every day? What do I believe about this? What are my values around it? How do I behave? How do I speak about it? What are the systems that we have in place that tell people I am this culture of good customer service and so on and all that? So think of it this way. Culture equals behavior, or behavior and culture is the same thing, because that's how people learn who you really are, by the way that you behave, the way that you treat each other. Morale sometimes gets confused with culture, and morale really has to do, because it's a more of an emotional thing, morale really has to do with your attitude. So we're going to put that on the side. We're talking about culture, but a poor culture can lead to poor morale. But morale and culture are not the same thing. Morale, in my opinion, would be a byproduct of a poor culture. So if I'm talking about behavior, some of you might already be jumping ahead and thinking to yourself, is he talking about me? And the reality is, yes, I am talking about you. If you're watching this webinar tonight, if you're participating, then to me, you're like a leader. And a good leader role models the behavior that they want other people to emulate. Now, if you're the owner of the business, or perhaps if you're the dentist, then this is even more important. But in a sense, we're all leaders in every practice because our behavior rubs off on other people. And so what I'm going to ask anybody who's in a leadership position, specifically if you're a dentist, is, are you role modeling the behavior you want your staff to emulate? Now, dentists have it a little bit more difficult because they wear two hats. They are the leader of the organization, and they are an employee of the organization. So, you know what I mean? They're the leader and they're the employee. And so what they forget sometimes is the staff expects them to follow the policies and the scheduling and the phone systems that we put in place, and the values of how we charge for things and all that. They expect that those things to be followed by the owner of the business as well. So the owner of the business teaches the staff their values by the way that they're all implemented. So again, what I'll say is, are you role modeling the behavior you want your staff to emulate? And doctors have it tricky because they are the boss and they are an employee at the same time. So they've got to be very, very careful about the way that they present themselves at all times. So when I think of culture, I think to myself, what you do, that is what culture is. And how you do it defines the perception of quality of customer service. And so what that's going to do is develop your professional reputation, and it's going to create loyalty from your patients. So don't forget, this also includes vendors and it includes specialists. You see, if you have a culture of professionalism, it doesn't stop with just certain people. It's something that we carry on with everybody. If we have a culture of integrity in our office, meaning we uphold very high standards and we do things on a very ethical basis, and it's all designed on a standard of care, then that is going to be taken forward to anybody that we come across, vendors, specialists that we work with, anybody that comes into the practice. And so these types of things in our culture also affect our ability to problem solve. And so again, it's a way that we do things. It's about our behavior. And if you want to enhance the culture in your practice, or if you even want to change the culture in your practice, what I'm asking you to do is take a look at yourself. What do you believe? What are your values? How are you behaving? What is your language like? You know what I mean? Are you participating in the systems? What are your work habits? Because that's what's going to define how the culture is going to evolve in your practice. So what behavior supports this? If you say to yourself, you know what, I want to have a culture of professionalism, and I want a culture of teamwork, and I want a culture of problem solving and good customer service. Those are all good, noble things that people say that they want to have, in their culture. So you have to say to yourself, well, how has this been defined? In my definition, what is professionalism? Because I would say that you demonstrate the behavior that you would use to demonstrate professionalism is going to come along in the way that you dress, how you present yourself to the public. It is going to come across in your verbal skills, particularly when you're talking on the telephone. Those are just some examples of, how are we defining professionalism in our office? How do we greet people? Do we use their surname? Is it Mr. Gazzardo, or do we just say it's Larry? Every office is going to be different, but you've got to decide how is that done in our office. But that's what's going to exhibit a culture of professionalism, because we've examined all of these things. If you want to have a culture of teamwork in your practice, you can't just say, well, let's just be a team. We've got the same uniform on, we're wearing our name badge, we all went out and had margaritas together, ooh, we're a team. And then they come back to the office and they're all fighting each other because they don't have the ability to help one another. So the system that you put in place to demonstrate teamwork would be cross-training. And we talk about this in a lot of our other courses, But everybody should be trained on the basics to check in, check out a patient. They should be able to answer a phone call, print out a walkout statement. If the staff comes across anybody in the office should be able to answer just the most basic questions. And if they can't answer the basic question, they should at least be familiar with who could answer that question, so they can say, you know what, that isn't something I do every day, and I know Susie does, so I'm going to bring you to Susie, and I'm going to hand this over properly. But my point to you is, we say we want teamwork. How do we demonstrate it?